Welcome. Case study number 3. My life working in the lymphatic system industry. My name is Marjorie Velasquez, licensed and insured with more than 25 years of experience. Understanding lymphatic drainage therapy. Post-parotid gland surgery. When a person undergoes surgery for acinic cell carcinoma of the parotid gland, the procedure often involves removing part of the gland and surrounding lymph nodes to prevent the spread of cancer. This surgical intervention can significantly affect the normal lymphatic circulation in the neck and face. What happens when lymph nodes are removed? Lymph nodes act as filtering stations that help drain excess fluid, proteins, and waste from tissues. When lymph nodes are removed, the natural drainage pathways are disrupted, leading to fluid buildup, swelling, lymphedema, tightness, and sometimes discomfort or limited range of motion. Manual lymphatic drainage, MLD, or lymphatic enhancement therapy, LET, can play a crucial role in recovery after surgery by stimulating alternative pathways. Lymphatic drainage therapy gently encourages lymph fluid to reroute through the remaining healthy lymph nodes and vessels, helping to reduce swelling and prevent fluid stagnation. Reducing post-surgical swelling. By promoting fluid movement, lymphatic drainage therapy can help decrease facial and neck swelling, which often occurs after parotid gland surgeries, minimizing the risk of lymphedema. Regular sessions can support proper lymph flow, which may reduce the long-term risk of developing chronic lymphedema in the face, jawline, and neck. Enhancing healing. Improved lymph circulation brings more oxygen and nutrients to the tissues, potentially accelerating healing and reducing scar tissue formation. Important considerations. Timing is key. Lymphatic drainage. Therapy is often introduced after the acute healing phase, once the surgeon clears the patient, to ensure it's safe to manipulate the tissues. Gentle techniques. Post-cancer surgery. Therapists use extremely light, precise techniques to encourage drainage without overstimulating or putting stress on the area. Holistic approach. Lymphatic drainage. Therapy should be part of a collaborative recovery plan that may include physical therapy, oncology follow-up, and patient education about self-care and manual drainage techniques. Summarizing this case, lymphatic drainage therapy, along with our pulsed electric magnetic field, LymphStar Pro equipment, manual massage on the upper body, neck and face can significantly support patients after parotid gland surgery with lymph node removal by redirecting lymph flow, reducing swelling, supporting tissue healing, minimizing lymphedema risk. It is a gentle, safe, and effective way to restore balance and comfort to areas affected by surgery. If you or a loved one is experiencing this condition, know that we as a community of licensed, experienced lymphatic drainage therapists nationally are ready to walk along with you during this healing process. You don't have to live with the after effect of a life-saving procedure. You have the right to improve the outcome for a better aesthetic and mindful presence. You can reach us for consultation at our website for contact information www.lymphaticmassageflorida.com. Thank you for watching.